my name's Pooja Desai. I'm a first-year PhD student here in the department. I originally grew up in California, in the Bay Area, and then came to New York to pursue my undergrad degree at Barnard, and then took 2 years to do research. I wasn't sure if I wanted to do a PhD in biomedical informatics or pursue things through the medical route. So I took about 2 years to explore that before deciding on the PhD route. So I was a neuroscience major as an undergraduate. I sort of was trying to balance a couple different things, and it took me a little while to figure out what my exact interest was. But I was really interested in data, and I was really interested in data related to people. And my undergraduate school at that point didn't really have a concrete computer science program. And so I minored in computer science and statistics, which allowed me to sort of focus on that. But then I was really interested in challenges that affected people in public health. And I was able to start doing work in a neuroscience lab that was focused around public health outcomes for children. And that allowed me to sort of couple both my computer science background with some of these more public health society oriented questions that I was interested in. So, I mean, my path to informatics was like a little bit circuitous, to be honest. I guess I had first heard about it maybe when I was in high school under sort of like the framing of big data. And as that started to emerge of, even just sort of an industry of, there's a lot of data, we can tell patterns about people, and you were seeing that come up in advertising, you were seeing that come up in a lot of commercial spaces. And then I think it was sort of like really had sort of started to see informatics emerge more as something that could be leveraged to support people and utilizing this data to really help people. And one of the areas I was really interested in, and I actually found about this because I was working on a project around early in my undergrad career around telehealth services in India. I was sort of interested in public health, and they were really using the informatics approach to provide healthcare to many, many more folks than just sort of your standard radiology visit could help. So they were using informatics to support telehealth around the country. And it was sort of through that I was like, oh, well, this is kind of like this data side that I want to know more about. I want to explore a little deeper. I was interested in sort of the impact it had to support people beyond sort of like one patient to support many patients, and leverage what we knew about them outside of just one interaction to really support their care. And at that point, I was also sort of like undecided between medical school and informatics, and if I wanted to go into healthcare itself or the practice of like using healthcare data to support the healthcare process. And so I actually, as an undergraduate, to work in the department with Lena Mamikina, who's currently my advisor. And we were working, and at that point I was doing a lot of work around diabetes, and we were working on developing mobile apps to support diabetes management. And for me, that's really personal because everybody in my family has diabetes. It's something that like everybody in my family has struggled to manage. And we were able to focus on the experiences of folks and helping people outside of the clinic, which in my experience has been when people really sort of struggle to care for their disease and support, and it struggled for support, and to be able to sort of help to create some of these apps and build some of these apps to help people outside of the clinic and sort of see how their data could be used to generate algorithms that could then help them make better decisions and support their care. Was something that I pilot tested in my own family, and I could see how much it helped my grandparents. And it was that sort of like personal thing of I could see how much it was changing people in my own family's life. And I became really sort of like passionate about that and wanting to sort of see if I could sort of use informatics to do that on scale. And I think that's really what sort of tipped the scales for me to think about sort of informatics of how can we use people's data to help them live a better and healthier life. So I'd say I think really the reason I picked Columbia University as a whole and chose to stay here for both my undergraduate, and then because this was true, I stayed here for my postgraduate training as well. And my favorite thing about the university is I think you really have the opportunity to scale up and scale down depending on what you need and where you are at in your career. So when I was first starting out and really sort of want to focus more on what's happening locally, what's happening within the university, and learning from scholars within the university, I have the ability to do that. But because Columbia has such a sort of a wide reach of different programs it covers, and a lot of connections between those programs, if there's something in the public health department that I want to explore, or something on another in the computer science department I want to explore that's related to my broader interest, there's a lot of flexibility to move between and sort of take classes everywhere, learn from sort of scholars everywhere, learn from talks everywhere. It's a really vibrant intellectual environment in that way. But then the other thing that's really nice about Columbia is that it's not only connected to this the larger like NYC system, but well connected sort of to the world. And so when I'm sort of at the place that I want to hear outside perspectives, there's a lot of opportunity to do that. If I want to get involved in sort of larger citywide projects and initiatives, there's opportunity to do that. If I want to get involved in larger national initiatives, as I sort of try out different things I'm interested in and explore different spaces, there's the opportunity to do that. And I think I just had so many fantastic opportunities to work with great mentors who like really cared about me and really sort of challenged and pushed me to work on certain questions of interest. And then New York City is just a fantastic place to practice thinking out ideas and challenging those ideas and testing out those questions. It's, you know, it's really its own total ecosystem. And so you really sort of get to see a lot of different things that play and a lot of different factors that play and work with lots of different kinds of patient populations and folks from different backgrounds. And it's a really nice sort of like place to get cross-pollinated ideas and practice learning how to be a researcher. As a first year student, I basically spent this year rotating through 2 different labs and then selecting one to follow for the rest of my training. So I rotated with Lena Mamikina, whose work focuses on personal health informatics and work outside the clinic, developing mobile tools for chronic disease management. And then I also worked with Karthik Natarajan, who does a lot of work around observational health data and data curation, and observational health data isn't something I had worked with a lot. And so I got the chance to sort of dip my toes into the Odyssey network and the work happening there, which uses and leverages a lot of large-scale observational data from health institutions around the country, actually around the world, to explore sort of questions related to health and health outcomes. And so those gave me 2 really different perspectives on sort of how we can use informatics to support health and healthcare decision-making, both from like data collected from individual people themselves and the larger scale data collected from institutions and like larger claims databases that can still support healthcare and healthcare management. A little bit of background on me. I actually was like a graphic designer by sort of training, and by hobby on the side, I would make science infographics for like organizations like TED, and that was just like a hobby of mine. But the area of research I kind of do is on human-computer interaction. So it's really thinking about how do people interact with these informatics systems in a way that's usable, understandable, actionable, accessible for them. So we can develop these algorithms, as is often done in the department, to use people's data to generate insights, but then how do we actually communicate it to people in real time so that they can act upon that data and use it in ways that actually benefits their health and decision making. In the case of like exploring chronic disease management, one of the challenges that I've really focused on is sort of how people understand how health information communication, especially among patients who aren't so familiar with sort of the medical system and don't necessarily have a high level of medical literacy, but it's important for them to be able to understand their own health data. And so a lot of my past work has sort of focused on how can we use visualizations to better communicate health information? How can we how can we help develop models that are a little bit more understandable and explainable? And now my work is sort of going into this sort of direction of how can we generate models that can sort of explain what they're doing to folks in a way that's easy for them to understand based on their decision context. So if they're at the moment of making a decision, how do we give them the right sort of recommendation or explanation of what they should do, that they can take that into account, but still have the agency to make a choice? So for example, we do a lot of work around, one of the current problems I'm working on is an app to help people forecast their blood sugar. So they can take a picture of their meal. We can forecast using all of this personal informatics data based on their past blood glucose readings, how their blood glucose might change, which is really important for diabetics because it's important for controlling diseases, monitoring their blood sugar. And what I'm working on now is how can we give people sort of recommendations for how they should improve, understand past patterns in their data, and explain why we're reaching the forecast we're reaching, what behaviors that they can change or act upon to make their health even better. So that's sort of the area that my work is going into. A lot of it is around sort of like perception and interaction experiences, in addition to this informatics side, which is something I really love. But it's an interesting chance to sort of see a new lens of informatics, because the data is important, the algorithms are important, but they also only matter if people understand them and can act on them. And so seeing that end is sort of really important to me, making this accessible to everybody. So I didn't know that this was a field that I could enter through high school, through most of college. I feel like I had all these different interests. I was like, is this public health? Is this graphic design? Is this human factors engineering? Is this neuroscience? Is this psychology? Like, I didn't know how to put all those things together. So one, it is a field. There's lots of people working on this problem, but I would say if you're a high school student, like, do anything you can to try to try it out. So I think there's like a lot of freely available resources online with like Kaggle and Coursera classes to really sort of like dive into little parts of the field that might be interesting to you. I think the best thing that helped me was like just getting coffee with people. I think you can like reach out to people in the department. Certainly feel free to reach out to me, but other folks, and just like contact them to let them know that you want to learn more about this space. There's a lot of different sort of like free resources and events. There's great YouTube videos to check out. There's great people to follow on Twitter, but anything you can to sort of start to observe the conversation, read a little bit more, chat more with folks who are in it, even if you don't know exactly what you want to do. Like, it doesn't have to be so well thought out, but just to sort of like grab coffee with somebody on Zoom or something and like talk a little bit more about it and your interest. I think the thing that most helped me like figure out that this is what I wanted to do was the chance to work on sort of small research projects. And they don't have to be like the most formal thing, but sort of like smaller research projects. And I think there's a lot of opportunities for high school students to do that if you know where to look. So sometimes this can come about from like reaching out to somebody who does work in this area and saying you want to work on something, and people are more open to that than you'd think. But also, like, because this is informatics and we utilize data that's available often, using things like Kaggle and Coursera that already have, or like even government existing data sets that already have data sets, and trying to explore some questions that you might have, and like build skills around areas that you might have, especially when it comes to like computational skills, which can be hard to acquire, but important as you like go forward in this sort of training, I think can be really helpful. So I'd say explore all the free resources available to you, try to learn as much as you can, try to see as much of the conversation as you can. My hope is to somehow continue doing research. I love to teach, I love to mentor, and be able to do some of that while also thinking a little bit about sort of how we scale and implement some of the insights that we have that can inform policy and decision making as a national or international level.